Hi, my name is Guadalupe and I'm an ICU RN, and this is Genesis, our patient for the day. And we're going to show you some of the cool features from our new beds that we're very excited to use. They're the Progressive Pulmonary Stay-in-Place beds, and we're going to show you some of the cool features that come with our beds. One of the main things that we're very excited about is the pulmonary features that come with this bed. They do promote early mobility for our patients, which is a big step in getting our patients out of the hospital, reducing their hospital stays. One of the big features that we really like and enjoy is the rotation feature. The bed will actually rotate side to side, rotating our patient's body to the right, center, and left, and you can change the time frame, how long you want the patient to be on one side, and that helps. It's very beneficial, especially for our intubated patients that can't mobilize their body themselves. It does help mobilize secretions and prevent further complications such as pneumonia and atelectasis. So you can pick the time frame that you want your patient on each side. It also comes with a percussion and vibration feature also, and we're going to go ahead and start it, but it's just a little massage for our patient, vibration, and it helps mobilize secretions also and prevent the atelectasis. Secretions can lead to nosocomial pneumonia and neuromuscular dysfunctions. We have a turn assist feature, and we're all super excited to use it because it's going to be a lot easier on our backs, as well as easier for the patients, more comfortable for us to turn them. We sometimes do get confused patients or restless patients that like to move their own bed, and if they do move it below a certain degree, it does increase their risks of complications. So this bed now allows us to lock the bed into a certain degree, which is displayed on the screen. It helps us lock it into that degree to where the patient is not able to control that. And if they are trying to mess with the settings, it will alert the nurses right away. Another thing that's very nice about this bed is it does detect the patient's weight and body shape. So the bed conforms to the patient's body pretty much. So if there's a patient that's very heavy set and has lots of pressure on their bottom, it will sink in to where it helps release the pressure on their bottom. It has an area that allows for radiology to place their cassette for x-ray with minimal interruption and discomfort to the patient. Slides in easily, and it is also easily removed without having to reposition the patient several times. This bed also has the ability to adapt to a patient's height. So our model here, she's the same height as I am. We're not very tall, so it does have the ability. This is as short as it goes, but if we are to have a patient that's very tall, it does have the ability to grow and adapt to their height. A lot of patients that we get also, doctors have an order for us to elevate their foot of the bed, and back with our old beds, it would just basically bend at the bend of the leg. Now it does have the ability to bend the bottom half of their legs to where it's more effective also, and it helps with circulation and helps us prevent blood clots. The progressive bed surface comes with an advanced feature such as the microclimate management that keeps the patient's skin cool, dry, and comfortable, and that helps prevent skin breakdown a lot. We are going to be doing an early progressive mobility program, and these beds will allow us to get our patients mobilized a lot faster. It does have the ability to turn into a chair recliner, and then from the chair position it does go to a standing position. So these beds will help us get our patients into those positions a lot safer and quicker than we would have been able to before with our older beds. Now the seat is deflating, so it does deflate their bottom to help get the pressure off of their bottom in the sitting position. And it helps to just push her back up and prevent her from sliding out of the chair. And this position is also really beneficial to our patients. That way they can eat in a sitting position, prevent their risk of aspiration. So at this time we would put our gait belt on our patient and just kind of help them stand up as easy and safely as we can. But if you see, it basically has our patient in a standing position.